Mieses, and I'm a family physician. I was born and raised in New York City in a borough called Queens. My dad is from the Dominican Republic and my mom is American. When I was really young, my parents split up and I was raised by my mom and my grandma and my mom's side of the family. Neither one of my parents went to college, and so I'm actually the first doctor in my family. So, as a family physician, I get to take care of patients of all ages and I get to manage all sorts of medical conditions. So, to give you an example, I do everything from deliver babies, take care of children when they're young, take care of people when they're sick, like when they have a sore throat and things like that. I also manage diseases over time. Those are called chronic diseases. So if you think about diabetes or high blood pressure, patients come to me regularly for their medication and for their checkup. And then I also get to take care of patients when they're older and help them figure out what's important to them at the end of their life. I love my job. I never know what I'm walking into as I'm about to open the door to my patient's room. I can have a patient who's 90 years old. I could have a patient who's 9 months old. Someone might be coming to me, because they recently found out that they're pregnant, or maybe they were cooking Thanksgiving dinner and cut their finger open and now they need stitches. So that's the really cool thing, that family physicians don't just do the medical sort of prescribing medicines and things like that. We also get to do procedures, deliver babies. Some family physicians even go into the operating room as well. It just depends on where you live and where you practice medicine. So to get here, I had to graduate from high school, do 4 years of college, and in college, I had to take certain required pre-medical courses, do really well in school, and take an exam called the MCAT, and that's what's required to get into medical school, most medical schools. Then there's 4 years of medical school, and at the end, you decide what specialty it is that you want to go into, and you do your residency. So, family medicine residency is 3 years, and I recently finished my residency. So, that's a big accomplishment, and I'm very excited. So, now what I'm getting ready to do is start a new job. I'm going to be an assistant professor in family medicine at the University of North Carolina in Chapel Hill. I did my residency training at Duke, which is in North Carolina, and I fell in love with the area. And so now, like I said, I'm staying here for a job at UNC. And as a clinical assistant professor, I get to do a lot of different things. So I get to do all of the patient things that I told you about before, but I also have some protected time to teach and mentor medical students and the next generation of physicians. And for me, that's very, very important because, like I said, I'm the first physician in my family, and it is 100% true that my family always taught me the importance of education, always encouraged me to do my best, always encouraged me to pursue my dreams. But when it came down to the nitty-gritty details of what classes do I have to take in college, how do I pay for medical school? For someone like me who comes from a disadvantaged background, are there programs available that can make this whole process more affordable? And so that's where mentors came in. Then also, as a family medicine physician, I get to have this impact outside of the examination room or outside of the clinic or the hospital. And I get to do things like teach and mentor, but also be involved in advocacy where I'm, engaging with lawmakers and legislators on behalf of my patients in hopes that it will lead to some policy change that improves the lives of my patients. In addition to going to medical school and getting my medical doctorate, I also got my master's degree of public health. And normally to get an MPH, it's a 2-year program, but I did it combined with my MD all together in 4 years. And that was really important for me because the thing that drew me to medicine was this idea of social justice and, kind of working to combat health disparities. Some of my earliest memories are of me taking care of my mom who has diabetes. And I remember helping her check her blood sugar. I remember going with her to her doctor's appointments and seeing what that relationship was like. And so that's what ultimately inspired me to become a physician. But I also knew that for me to get fulfillment out of my work, I also wanted more than just that one-on-one patient interaction. And so that's why I also pursued a master's degree in public health. And it served me very well. I've gotten to do a lot of different things, served on a lot of different committees at my local but also national level. My advice for you, whether you're interested in medicine or science or math, whatever it is that you want to pursue, there are two important things. First and foremost, make sure you do everything in your power to be prepared. That means keep an eye out for scholarship opportunities. Always think a few steps ahead and think about, okay, if it's time for me to, get ready to apply to college, what colleges would I want to go to? Once you're in college, make sure you're always thinking ahead of what classes you need to get into either medical school, graduate school, whatever it is that you're pursuing. And the truth of the matter is that sometimes you can't be that prepared without the guidance from others. And so that's my second piece of advice is, yes, you have to do your part. You have to do well in school and you have to be proactive about achieving your goals, but you also need to find mentors who are invested in your success. They're going to guide you, they're going to point you in the right direction, they're going to serve as your cheerleaders. And I promise you that on this journey, you will meet at least one, if not more, people who will tell you that you cannot achieve what you want to achieve. And it's at moments like that that you rely on those mentors to build you up and help keep you on that same path. So I hope that that was helpful, and I wish you guys the best of luck.